The main problem is there is a blood supply interruption. We know that the hip joint composed of blood supplies from the medial femoral circumflex artery, the lateral femoral circumflex artery, and the Legg-Calve-Perthes. But most commonly affected is the medial femoral circumflex artery. There is also a transient ischemic necrosis of the capital epiphysis of the femur. So you can see on the picture that if there is a interruption of the blood supply of the hip joint, the femoral head, which has a spherical shape, it will be affected, and the bone cells of the femoral head will become necrotized until such a time that the femoral head will be deformed, and thereby there is a deformity of the hip joint. So are there any tests of this condition? Yes, you can detect it through MRI and plain X-rays. Through MRI at T1, you can see that there is a osteonecrosis of the hip, while on the plain X-ray, you can find out that there is sclerosis of the femoral head. So this is the sample of my patient's X-rays taken from Alborg Hospital. You can see that on his right side, which is the affected one before long time ago, the arc still in situ, which will be taken out next month, July. While on the left side, which is the his main complaint now, you can see that there is a good healing of the femoral head. So upon evaluations, pertinent findings reveals that all of these problems are seen. There is a tenderness on the lateral side of the hip, weakness of the hip adductors and abductors. There is a true leg length discrepancy of 4 cm. There is a LOM of 5 degrees of hip abduction, and a minimal muscle wasting of the quads. Do I talk fast? Okay, so how can we manage this case? So we know that there is a problem of the hip joints more on the blood supply. So that there is a main goal. Before treating this patient, we have the main goal. First is the primary goal. There is a containment of the femoral head with the acetabulum, meaning we have to maintain the angle of femoral head within the acetabulum while the treatment is going on. Secondly, the age of the patient. The younger patient has a good prognosis. And thirdly is how severe is the case. For the initial management, the patient is usually given analgesia or pain control. And secondly, we will have to modify the activities of the patient. We have to advise the patient as well as the parents to modify his activities, like avoidance of the heavy impact of the joint, the affected joint, like jumping and running, because of the weight bearing of the joint is not good. Third is that we have to preserve the abduction movement, like by the use of, you can see the pictures during bed rest. The patient will use braces, crutches for walking, special leg braces during the healing process. I'm talking about the mild cases. Okay, will surgery be needed? Yes. As I've told you, the management could either be the severity of the case. So for the severe cases, for older children, surgery is needed, indicated, and also for the very severe cases. Okay? So as a physiotherapist, what we can manage for this case is, as I told you, we have goals. We have to avoid the impact of the hip joints. One best exercise or exercise that's to be given to our patient is swimming and biking. For my patients, since his schedule is only nighttime, I'm only giving biking, active assisted ROM, strengthening exercise, but I'm not giving weight-bearing activities such as steppers or jumping or what. So we have to avoid jumping, just like that exercise of the trampoline or any activities that has a weight-bearing activities. So that's it. Thank you.